The Joanne Gay Dishman Department of Nursing at Lamar University serves 800 students from around the world using cutting-edge technology. The 4-year Bachelor of Science in Nursing program is designed for those looking to assume leadership roles in the healthcare industry and prepares professionals to meet community and state needs. Along with classroom instruction, students are given the opportunity to learn through practical application in the state-of-the-art Clinical Simulation Center. In the course of study, students participate in clinical experiences in local hospitals, doctors' offices, clinics, schools, and public health agencies. The Clinical Simulation Center exists to ensure students receive the same experience in specific scenarios by exposing every student to select types of common, complex, and rare situations. Students are able to use the information they have learned in class, apply it to patient situations, and make informed decisions, allowing them to see the positive or negative outcomes. The Clinical Simulation Center is an excellent place to learn without the risk of causing harm to patients. The center is a 10-room suite resembling a hospital and is capable of conducting medical, surgical, critical care, emergency, obstetric, pediatric, mental health, community leadership management, and large-scale interprofessional scenarios. Each simulation room is equipped with a mannequin or a live patient portrayed by an actor. Rooms are also equipped with a computer for documentation, medication administration supplies, procedural equipment, and a telephone to inform the primary care provider of changes in the patient's condition. Faculty members run the simulations from the control room, equipped with live audio and video feeds. Additionally, the video software is capable of streaming the simulation to debriefing rooms, where students can critique the actions of their peers.
You don't see yourself making mistakes when you're doing the situation, and when you see someone else do it, you learn from someone else. And you also sometimes get to see yourself doing it, and you're like, I did that, I'm sorry. So it's better to have someone critique you that's a friend and that they're in your level than an instructor, because you take it a lot better.
The center promotes patient safety by placing students in a realistic and oftentimes hectic situation to teach how to make quick and accurate decisions. Students credit the center for their success on exams and their confidence in handling situations they encounter in hospitals and other healthcare agencies.
The simulation is starting now.
So, Mr. Bunker, what brings you to the ER today?
My chest. My chest is hurting.
Can you tell me what your pain is from a scale of 0 to 10?
Dude, if 10's bad, it's 15.
If we didn't have the sim lab, we would never be able to work as a team without a professional that already has experience.
He has an elevated QRS. Mr. Bunker, have you taken any nitroglycerin?
The simulation lab really gives me the hands-on experience that helps me to be more prepared for when I actually go and do my job in the hospital. It was very nerve-wracking at first because I've never experienced that, and I'm very thankful to actually get that experience.
You're not learning from a book, you're in real life, so being realistic, it really puts it into perspective. We've had situations where we come out of the room panting and our heart rate's up because it is real, and that's what they're trying to do. They're trying to prepare us for real life.
Having this high-fidelity simulation labs gives us an opportunity to provide an environment where students can make decisions. They get the opportunity to call the physician, which again, they don't get to do in the hospital. They get to make decisions, they get to administer medications that they would not get to administer, like today, they gave morphine. In the hospital, they cannot give morphine.
We have much bigger plans that we have for the Sim Lab. We have been working on this project approximately 8 years, trying to find the resources and the personnel Our number one goal here in the nursing department, the Dishman Department of Nursing, is to make sure that when our graduates graduate that they're competent and to really get the nursing experiences that they need in order to do that. And we really believe, and the research supports, they can do that with the SimLab. What's holding us back right now is the lack of personnel and some of the resources, some of the computer adaptive equipment that we can use. And we are really working towards an accrediting SimLab. There's very few in the world, and there's none in this area. Our long-term goal, and a goal that we're working for within the next 3 or 4 years, we will be starting a doctorate in nurse practitioners with the new healthcare reform. The research shows that we are going to be in great demand in the next few years for advanced practice nurses. The Dishman Department of Nursing is one of probably the finest nursing departments in the area. We already believe that, but we have the opportunity today to make that even more of a reality.